Well, delegates, you've seen attacks on our universal healthcare system, our Medicare insurance program, and we articulated this last year, and unfortunately it's rapidly coming to pass. Our public health system, our universal health system, is being set up to fail and make way for the private sector to take over, and we are left with the public system as simply a safety net for the poor. The Abbott federal government's first budget presented savage cuts to health and social welfare spending. The proposals for a $7 co-payment for GP visits, radiology, pathology and increases in pharmaceutical co-payments are a complete and direct attack on the principles of our Medicare system. We've seen the federal government pass legislation to pay incentives to state governments to privatise infrastructure. So the selling off of public property to the private sector so that they can make a profit out of it. We've seen the release of the National Commission of Audit report, and we stand against almost everything in that Commission of Audit. We heard today the Minister happily declare that there was another record $19.9 billion health spend in New South Wales. But for us, it delivered disappointment in terms of being able to say, we know that they're ready, prepared and able to deal with increasing demands of the future and to properly address the need to guarantee that those services will be available. 2.27% increase and 2.25% added to superannuation. Naturally, the award has been varied to pass on that 2.27%, and that's a pragmatic decision and a decision that you've supported with 179 branches voting and articulating this morning how you feel about that. We have a Premier who is very vocal about his support for privatisation of services and public health in his own electorate, and he's very clear about his view of privatisation. We have a minister who stands up and says we've got the best public health system in the world, and yet what's their idea? Oh, we need to sell it off to the private sector so we can get a better system for the people of Northern Beaches. How insulting. You've never seen such prevarication by a local member and a minister trying to avoid to answer the question about who will build, own and operate the new Maitland Hospital. The Premier even went up there and stood outside the gates and made another announcement that he was in the hunter and here was the new Maitland Hospital. And when he was asked, how will it be delivered? It'll be delivered in 5 years' time and we'll tell you about it at some stage. The new Byron Hospital, how will it be delivered? A PPP in what format? Complete handover to the private sector, or will it be a different model because there aren't as many privately insured people up there, and the Ramsays and the Healthscopes of this world may not see it making as big a profit as they need to be able to sustain it. About this time last year, we were running ads about the intention of the federal government and the state government to privatise our health system, take us down an American route. We told the New South Wales community what they were facing, and we were called liars for telling it. But we could see the writing on the wall, the real messages behind what was being said and done, and it's on its way unless the Australian people can stand up strong and loud and let the federal government and the state government know that that's not the direction we want to go in. A famous Nobel Prize-winning economist, Joseph Stiglitz, on a speaking tour here recently nominated Australian budgetary changes to university fees and Medicares as the two biggest mistakes the Australian government could make. You also saw a great councillor and delegate from Nepean, Kerry Rogers, take on Joe Hockey on the Q&A. Kerry was standing up for what she believed in and for what we believe in, standing up for her patients and her profession and being a force for change. Congratulations, Kerry. Keep it up. You've been doing great work. We will have to be a force for change. As nurses and midwives, we have a very strong duty to stand up for our patients, to stand up for our communities, and to stand up for ourselves as consumers to make sure that we have a health system that meets our needs.